Let's be real. Every step was a battle. Forget running anymore. I couldn't even walk through a grocery store. And my knee pain wasn't just part of my life, it actually became my life. But here's what makes my story different. I had already had knee surgery in 2013, and for 6 years I had pretty much perfect knee. But then my car accident, and then a knee replacement in 2023, and it failed. Not because of infection, not because of rejection, but because the parts were installed wrong. And when I told my surgeon that there was something wrong, he looked at me and he said, "Marion, you're just going to have to live with it." Hi, I'm Marion Barnick, kinesiologist with over 30 years of experience. This is my journey through knee replacement surgery. This is the behind the scenes of what can go wrong and what they don't tell you, and how I fought to make it right. To understand how devastating this was, we need to step back a little bit. Mother's Day of 2013. I was doing my exercise, nothing crazy, just normal stuff. And I was doing a burpee and bam, my knee pain was excruciating. I heard this crunch and I dropped. I knew something had happened that was very, very wrong. When the MRI came back, we found out it was avascular necrosis. That means bone death. So when you look at the x-ray, when you look at the MRI, you can see there's this area that's missing. That is where bone was supposed to be. And the prognosis was no walking, only using crutches. And as a single mom with a very active young boy, this was going to be almost impossible. So I looked at the research, I read journal articles, and decided that the best route for me was going to have a partial knee replacement. But I couldn't get that done in Canada. It wasn't offered at the time. So I went to the US. I had the surgery done and it was brutal. It was a tough surgery, but nothing compared to the pain that I had before. But in the interim before the surgery, I had gained weight. I had built up movement compensations trying to cope with it. So it was a tough battle trying to get back to where I was. But as a kinesiologist, I was really lucky. I knew what I should be doing. I knew how hard I could push, and I got back my function. I got back my range of motion. I got back my mobility, and my knee worked. It was awesome. And for 6 years, I had pretty much a perfect knee. I was able to get back to running. I was running with the dog. I was working out with my patients. I was working out with my son. I was invincible again. It was amazing. And then July 2019, car accident. A driver ran his stop sign and everything changed for me. Unlike most knee replacement candidates that go through the wear and tear of long-term arthritis, my injury to my knee was caused by trauma. And for a year, we were looking at x-rays and we were looking at trying to figure out what was going on with my knee. We had had an MRI, but because of the prior knee replacement, there was artifact. That metal in there was causing a problem where we couldn't get a good read on the MRI. And it wasn't until I talked to my surgeon who did the partial knee replacement, who told me that there's actually a program that you can implement on the MRI machine that takes away that artifact. But no one was ordering it. No one knew. And until we came in with that script, did we get a good MRI that showed the actual problem with my knee. And there were 2 grade 4 focal defects. Focal defects go from grade 1 to grade 4 being the worst. And this is an osteochondral defect. So your bone has the cartilage on the outside. So this had gone through the cartilage and actually gone to the bone. So there was bone chips and cartilage chips floating around inside my knee. Now we did surgery in January of 2021 to remove all those bone chips, PRP injections into the knee and into the torn tendon, and physical rehabilitation, ongoing, really tough stuff, but nothing was decreasing the pain and nothing was bringing back my function. there was only one choice left, and that was a total knee replacement, or as we call it, a TKA, total knee arthroplasty. So in February of 2023, I had my TKA. Now, because I'd already had a previous surgery on the knee, that partial replacement, this was considered a revision. So it's a little more complex. But what we did is we kept the back of the patella. There was a button on there for my partial replacement, but I lost my ACL, my anterior cruciate ligament. That was cut out. The surgeon said I didn't need it, that the components for the TKA were going to make up for what the ACL did. So I had the surgery on the Friday, and Monday I was in my therapist's gym ready for working out. But I told her, I already knew there was something wrong. It didn't feel right. Now, there's a difference between not feeling right and the strange feelings you get after a knee replacement. What happens is when that joint is replaced with those components, you lose what are called mechanoreceptors. And those mechanoreceptors are the things that give you proprioception, that allows you to know where that knee is in space. So you have your balance and you have that feeling of knowing what you're doing when you're moving. So that definitely is compromised after a knee replacement. But this feeling I had was not just that. It was that something was wrong. And my therapist thought I was crazy. It was only 3 days after surgery. But as we kept pushing at the 6-week mark and the 12-week mark and the 6-month mark, and all the effort I was putting in, daily exercises, like several times a day, one-on-one treatment 3 times a week, all my effort was not showing the results that should be seen with this knee replacement. So at the 9-month mark, when I went back to see my surgeon, I said, something's not right. This is not working. I have so much pain. I have so little function. And one of the strange things was I had this weird pain that started at the inside of my knee and went all the way down to my ankle, all the way down the front of my leg. And it was like this searing nerve type pain. And the only way to get rid of it was to turn my ankle out when I was trying to flex my knee. And that should have been a sign that we knew something was wrong with the components and with the surgery. But we kept pushing. And so when I saw the surgeon, I gave him all this information and said, hey, what are we going to do about this? And he looked at me and said nothing. He said, you're going to learn to live with it. This is the way it is. And I said, no. I'm 56 years old. I'm a single mom. I run my business. I've got a son. I'm not spending the rest of my life with so little function and so much pain. This can't be how the rest of my life is going to be. I will not settle for this. It's not going to happen. So he said, okay, we'll do a blood test. We'll see if there's any infection. And of course, that came back, no infection. We had no answers. So I had to go on the search again. And I did. I did more research. I talked to other surgeons, and I finally found a surgeon who listened to me. He examined the x-rays up close, and we saw that the tibial component, the bottom part of the knee with the replacement, actually overhung on the bone. It was too big. So it came back into the back of my knee and was slowly cutting through the soft tissue behind my knee. Not only that, but he ordered this special CT scan. And when it came back, we saw what I felt. Those knee components were actually rotated 20 degrees. Both the tibial component, the bottom part, and the femoral component, the top part, were internally rotated. Well, no wonder I was in so much pain. No wonder my muscles were exhausted. All my muscles were working overtime in my hips and my ankle to try and compensate for that rotation that I had in the knee. I felt vindicated. I knew that I had to push. I knew there was something wrong, and this doctor found it. So, what did I do with this new information? How did I confront the surgeon who told me I had to live with it? Was I going to have another surgery, and was this going to actually give me back the function? I'm going to give you all that information on next week's video. I want you to tune in because this story gets better. I'm going to let you know what happened when I confronted that surgeon. I'm going to let you know what happened when we decided to go back into the knee and do a third replacement. I'm going to let you know about a robotic assisted TKA and what happens when you've got such a buildup of scar tissue. You actually get another diagnosis. Stay tuned and I'll see you next week.